Hi guys, it's Adrian from Living Holistic Health. Today I just want to talk to you a little bit about a large problem that people come into our clinic with, particularly a lot of women, and that is the problem of endometriosis. So endometriosis is a condition that you may be familiar with. It's a condition where the hormones in a woman's body aren't balanced effectively, particularly the main culprit being estrogen. And generally the way that a woman feels is they can feel very painful, particularly around period time. So a lot of heavy pain, a lot of pelvic pain, a lot of really a real sort of sense of pushing or some pressure either side of the lower abdomen around the ovary area there. Endometriosis can result in things like adhesions or endometrial cysts, so little cysts that can grow on the ovaries there. They're sometimes called chocolate cysts. Which are typically resolved through investigation by conventional medicine. You might go to your GP and complain of this pain. They may then put you on to the pill or a version of the pill to try and influence your hormones, and then if that doesn't quite work, then they might just send you to a gynecologist for an examination. They might do an internal ultrasound to have a bit of a look inside there and see if there's anything they can spot in particular that might be out of place, like a large cyst or something like that. And if they can't quite detect that, then they may even put you in for what's called a laparoscopy, where you'll have to go into hospital for a day or maybe overnight, where they'll have a bit of a look around it more with a camera and so forth inside you and see if there's any endometriosis growing there. So endometriosis is basically what it is. It's endometrium growing in a place other than where it should, so outside of the area there. And it could be, for some women, they can even get endometrial tissue in their nose and all sorts of places, all sorts of cavities around the body. You can get anywhere, and that's particularly around menses time or period time. Then everything starts to bleed, all that tissue starts to bleed, and they can get a lot of pain. Even into the bowel area there, that can be quite painful, and problems with bowel movements, etc. So it can be a very, very nasty thing. Conventional medicine does generally tend to follow those sort of things. There might be some pain relief, so you might have to go on some pain relief, Nurofen or something that's a little bit more prescribed as anti-inflammatory, a little bit more like a Mobic or something. And then the pill is very often the first line of treatment, so a bunch of synthetic hormones in there to try and redress the balance there of your the way that your cycle's operating. And if that fails, as I said, then going in there with a camera and maybe doing a bit of lasering to try and, or the removal of the cysts or the endometrial tissue. But all of that isn't addressing the root cause of the problem, okay? And that is that the way that your body is detoxifying your hormones isn't working properly, okay? Particularly around estrogen. So endometriosis is typically a condition of what we call estrogen excess. And there are three main types of estrogens. We've got more information about this on our website. I won't go into the details now, but if you want to find out a bit more about the different types of estrogen with endometriosis, please www.livingholistichealth.com. Endometriosis, have a bit of a look. It's there in our women's hormones section, okay? It explains the different types. But basically, it's a failure of your body to detoxify that estrogen properly. And a number of things can be driving that. It could be some toxicity issues, so you could have some internal, what we call problems with your native or normal gut bacteria, so good and bad bugs. Might be some issues there. Could be some issues to do with some insulin resistance, so you might have problems with your body processing blood sugars and then effectively burning fat properly, so you might have gained a little bit of weight or carrying a little bit of weight. That can promote or make it harder for your body to detoxify estrogen properly, so that's another issue there. Or if there's any sort of condition which is driving inflammation in your body. So inflammation can be very, very useful when we cut our finger and it can resolve a wound, but if you've got this chronic inflammation grumbling along in the background, that can really drive this endometriosis, this condition, and make it really, really painful and bad for you, and just stop your body's ability to be able to detoxify that estrogen effectively, congesting you, and particularly in the liver where it mainly occurs, and in your digestive system, and it makes it really, really tough, and things back up, and then you get these problems. So, the nutritional medicine approach tries to look at the way that your body is detoxifying your estrogen, and to try and work out exactly what the cause of it is. It can be some genetic issues there as well, to do with this process of what we call methylation, which I'll go into in detail in another video. But, there's a number of factors there that could be driving it. Could also be problems with thyroid as well, and any of those sort of things. So any other hormone imbalances, so the insulins in your thyroid, can definitely affect your sex reproductive hormones. So that estrogen that I'm talking about there is one of those sex reproductive hormones. So that can all cause problems. So what are you going to do about it? Well, a nutritional medicine approach is, as I say, to try and work out what's driving it and to address this detoxification of estrogen effectively. Now, the best way that you can start to help yourself is through diet. And there are some foods, the cruciferous vegetable food family, as I've mentioned before in previous videos. So the leafy greens, 3 to 4 handfuls of those each and every day will help your body trying to detoxify your estrogen. Also, having a look at things like button mushrooms is really, really good to try and shift some of that estrogen detoxification there as well. But realistically, what you want to do is try and get some professional help to look at this estrogen imbalance in your body. And there are a number of tests that can be done. Not all your GPs will do it, or all of your specialists will do it. An integrative GP might, or a nutritional medicine practitioner may, to assess your estrogen detoxification capabilities and try and work on that rather than just giving you a whole bunch of drugs. So if you have a bit of a look at some of those specialists, they are the ones who will be able to help you with that picture. And if you've got a growth or something like that, there are cyst or some really, really bad, sometimes the endometriosis can get into the muscle and cause adenomyosis. That coupled with some more conventional techniques, so your laparoscopy is going in there and doing some more work with a scope, etc., in combination with some really, really good nutritional medicine therapy, as I've been describing, with certain foods and the certain supplements as well, which can be really, really effective. They will help to rebalance that estrogen detoxification, as well as removing any physical, large masses that might be floating around inside you there, and try and relieve the pain and make your life a lot more easy to live. So that's the nutritional medicine approach to endometriosis. It's a little bit different from the conventional. So we're looking at the root cause. We're looking at your body detoxifying estrogen, not just giving you another bunch of hormones, synthetic hormones, to try and upset the apple cart a little bit, as well as giving you some relief from the pain and inflammation, which is very, very often for a lot of women very, very restrictive and makes their quality of life very, very poor. So hopefully that gives you a little bit more insight into the nutritional medicine approach to endometriosis, and you can take it from there. Do with it what you will. Thank you.